New book, Patient Citizens, Immigrant Mothers, Professor Alyshia Galvez analyzes the difference between how Mexican women deal with pregnancy in their native country and the United States. Her research found that in Mexico, pregnancy is looked upon as a blessing, no matter what the financial challenge. But here in America, the same can't be said. And Professor Galvez joins us now to tell us more about her research and her latest book as we show it here. And as we said, it's Patient Citizens, Immigrant Mothers. And good to have you, Professor Galvez.
Thank you.
I was really struck as we talked before about the fact that, you know, in Mexico, I guess pregnancy is looked upon as a blessing, no matter what the financial status is. And for many people, that's a hard thing to understand and come to a realization of.
Yes. Well, when I started out this project, what drew me into it was when I learned about this phenomenon called the birth weight paradox. And basically the paradox is that usually we associate wealth with health. You know, the more financial resources someone has, we usually assume they're better able to take care of themselves by seeing specialists, you know, getting more proactive health care. And we see with Mexican immigrant women that actually their outcomes are better in spite of not having the advantages of wealth for the most part. It's a community that has very low income levels on average, low levels of education, and yet the birth outcomes are excellent. The infant mortality rate is lower than almost any other group. The rate of premature and low birth weight babies is lower than almost any other group. And so I was trying to figure out why is that and what is it that's happening that's causing that. And because I'm an anthropologist, I thought I would ask the women themselves. I'm not a medical doctor, you know, so I asked the women themselves, what is it that you do during pregnancy? And that was one of the first things that struck me, was that women were very likely to say this is a blessing no matter how inconvenient, and because of that the families rally around the woman to give her what she needs in the material sense, but also in the emotional sense and the social sense, so that she has all of the resources she needs to have a healthy pregnancy, which I think is one of the key factors contributing to these healthy pregnancies. What
should we learn here in the United States, given the fact of knowing that, you know, Mexico has this unique perspective? What are some of the things that we can learn from?
Yeah, well, when we look at different populations within the United States, we see, you know, we often tend to assume that healthcare costs a lot of money. And when we had the healthcare debates last year in the Congress, one of the clear facts that came out is that we're one of the countries that spends the most dollars on healthcare of any country in the world. And yet we don't have the best outcomes. We're 37th in the world in infant mortality, which is a disgrace and an embarrassment. So what can we do to improve our infant mortality rates and make sure that more babies are healthy to the first year of life? We need to look for solutions that don't cost a lot of money. We need to look for solutions that are very economical. And one of the places that we can look is right within our own communities at Mexican immigrant women who, without resources, without health insurance coverage often, without a lot of the things that we associate with health, are taking care of themselves in ways that cost very few resources.
Prenatal care, big thing here in the United States. How does it go in Mexico?
Well, part of the book is looking at the differences between women's lives in Mexico and when they migrate here, and how distinct and different that is. So a lot of the women, on average, the women in the book that I interviewed migrated 9 years before I interviewed them. And so sometimes they had had a previous pregnancy in Mexico and then had another pregnancy here, or sometimes they came here and had their first experiences with pregnancy and childbirth. But oftentimes they associate their home life with not having high-tech medical options, because in a lot of rural communities at the time when the women migrated, there wouldn't be a local clinic or a local hospital, and so women frequently gave birth at home with a midwife, and, you know, a traditional lay midwife, not someone who has medical training, but who knows by giving birth to babies how to do that. And for the most part had very good results. And when they come here, they're very excited to have our high-tech medical care. But oftentimes what they realize, and what studies have shown, you know, where researchers have looked at prenatal care in the United States, a lot of the things we spend money on actually aren't getting the results we want. So we're throwing money at a problem that maybe doesn't need money.
In your research, what was the thing that struck out to you the most?
Well, I was sort of looking, because a lot of people have described the paradox as this puzzle, this mystery, and that the person, you know, someone even told me, you know, the person who solves the paradox will get the Nobel Peace Prize. And, you know, that's intriguing and exciting to think about. But what I discovered was that there wasn't really any deep secret to what the women were doing to have healthy pregnancies. They had very simple precepts and ideas about what to do during pregnancy, and they followed them. And you know, it's not rocket science. It's you know, eat well, exercise, try not to work. Women had a very strong aversion to working during pregnancy, even in jobs that wouldn't be considered heavy labor or heavy lifting. And the family support, you know, that women should, you know, eat what they feel like eating. There's a very strong cultural belief in cravings, that if you have a craving, it's because your body needs something. So cravings are supposed to be indulged, you know, even if they're strange. Sometimes they are. You know, women sometimes describe wanting to eat clay and, you know, things like that that aren't exactly edible. But you know, it's very simple ideas about how to take care of pregnancy. But basically, I think what really it boils down to is the confidence that women have in themselves to have a healthy pregnancy and childbirth. And that's the thing that I'm most concerned about getting the message out with this book. Because when women have confidence in their own ability to have a healthy pregnancy and in their own knowledge, and that knowledge isn't shaken by the medical establishment, then they're able to have a healthy pregnancy. The problem is when they come into our public health care system and they're treated as people with low levels of education, as poor people who don't know how to take care of themselves, and the things that they know to do are shaken, are disturbed and displaced by that experience.
A little bit of an inferior complex.
Yeah, because the doctors, you know, look at the chart and say, oh, this person, you know, has Medicaid, this person has a 6th grade education, I need to give this person what she needs to take care of herself. Instead of asking her, what do you do to take care of yourself? Let me give you just a short example. There was one woman who told me, you know, when I was pregnant in Mexico with my first child, whenever I was nauseous, my mother would make me chicken soup. And this is country chicken soup. This is where you get the chicken, you wring the chicken's neck, pluck it, you know, real chicken soup, right? And that always helped her with her nausea. In her second pregnancy, she's here in the Bronx, right? She's going to a public prenatal clinic. She doesn't have her mother-in-law. She and her partner are by themselves living in the big city. And she's feeling nauseous again. So she says, oh, now I have this doctor, this health clinic that I'm going to for my prenatal care. I'll just ask him what I should do for the nausea. So she asks the doctor, and the doctor says, oh, just have some, you know, some salty crackers. You can get them at the dollar store. So I said to her, what do you think about this advice? And she said, it's great. The crackers cost $1. I carry them in my bag. But look at the nutritional difference between that chicken soup that she ate during her first pregnancy and the salty crackers from the dollar store that she did during her second pregnancy. Right?
Big difference.
And the doctor didn't need to do that. The doctor could have said, I see that you've had a baby before. What did you do in your first pregnancy? Go ahead and do the chicken soup again, instead of displacing that knowledge and substituting it with the crackers.
We want to tell you the book is called Patient Citizens, Immigrant Mothers, and you can see, or you can get Professor Alyshia Galvez's book where? Amazon.com?
Anywhere online, any bookstore can order it for you if it's not already on the shelf.
All righty, thank you. Congratulations on the
research.
Thank you very much.
And thank you for
giving us some enlightening information.